Hello, occupational therapy students. My name is Stephanie Shane, the founder of PASA OT, and the question I'm going to be breaking down for you comes from Module 3, Musculoskeletal Conditions and Interventions from PASA OT in the web course. In today's video, I'm going to show you how to get every question right with 6 simple steps. Simply fill in the blanks or write it down on your whiteboard, and remember the mnemonic. Read with diligence and patience before answering. So in step 1, which is R for read the question carefully. So here's the question. Randall, a construction worker, is receiving treatment for a low-level ulnar nerve lesion, which he acquired due to repetitive trauma from using a jackhammer. Randall complains of numbness, tingling, and paresthesia along the sensory distribution of the ulnar nerve, and his hand is starting to develop a claw hand deformity. The hand therapist decides to fit Randall with a dynamic mobilizing splint during the day and an immobilizing static splint in the evening. What is the best protocol to follow when fabricating splints for this patient? So in step 2, W, where is the question at in the OT process? So we know we are in the intervention stages. So in step 3, D for disease or diagnosis, what is the patient's disease or diagnosis? So is the disease progressive or non-progressive? Well, in the question, we know that the patient has a low-level ulnar nerve lesion. It's a good prognosis and can heal with treatment. In step 4 for P for problem, what is the patient's problem? What is the patient's level or performance or function, and what symptoms are they experiencing, and what are their goals? So in the question, the patient is experiencing numbness, tingling, and paresthesia along the sensory distribution of the ulnar nerve, starting to develop a claw hand deformity. So in step 5 for B, what is B or all caps, or what comes next, or what is the question specifically asking? So this question is specifically asking for the best protocol to follow when fabricating splints, a dynamic mobilizing and immobilizing static splint for the patient. So now we're ready to get to the answer choices. And when we look at the answer choices, we want to make sure we're addressing the problem, question, or goal. So is this answer ethical, safe for the patient, patient-centered, occupation-based, and purposeful? So now let's get to the answer choices. So here's the answer choices for A. A, position 4th and 5th digits in 30 to 45 degrees of MCP flexion. Finger loops with rubber traction attached to the 4th and 5th digits. Proximal phalanges and monitor areas of decreased sensation for pressure sores. B, thumb opposition and palmar abduction, all digits 45 degrees flexion, and elbow in 30 to 40 degrees of flexion, and monitor areas of decreased sensation for pressure sores. C, dorsal base using tendinesis position with the MCP joints in dynamic extension and monitor areas of decreased sensation for pressure sores. D, position the 4th and 5th digits in 30 to 45 degrees of MCP flexion. Thumb in radial abduction, finger loops to the 4th and 5th digits with traction to the distal phalanges and monitor areas of decreased sensation for pressure sores. So we know that B, C, and D are incorrect because B is incorrect because this positioning is for fabricating a splint for a patient with a median nerve injury involving the thumb. C is incorrect because it involves positioning and fabrication of a splint for a patient with radial nerve lesion. And D is an incorrect answer because this is an incorrect protocol to follow for low-level nerve lesion. Therefore, the correct answer is A. We want to position the 4th and 5th digits in 30 to 45 degrees of MCP flexion, finger loops with rubber traction attached to the 4th and 5th digits, proximal phalanges, and monitor areas of decreased sensation for pressure sores. In this way, the claw hand posture is corrected for MCP hyperextension and PIP flexion. With the MCPs blocked in flexion, the extensor digitorum communis transfers to the IP joint so that the joints can extend given poor activation of the intrinsic muscles. The splint will facilitate the functional grasp of the patient. I wanted to also let you know that our program, Pass OT, is set up holistically to keep you organized, build your confidence, and assist you with studying smarter and being more prepared for the actual MBCOT exam. We look forward to assisting you in passing. So please visit us at passot.com.